Thank you so much. My name is Kissa John from Ministry of Health, Uganda, under the UNEPI program, Uganda National Expanded Program of Immunization. And I am the data manager for the program, supporting health information systems, supporting data use, supporting informatics, and also ensuring that most of the programs and different stakeholders take a very good control in terms of using the data for informed decision making. And here today, we are going to be presenting, making a presentation in the TechNet Conference, improving cold chain equipment management in Uganda, a data-centered approach using the ODK X application. Thank you so much.
Thank you. My name is Jacqueline Anena. I work as Senior Program Officer for Vaccines and Immunization with PATH, Uganda Country Office. My work basically has been focusing so much on supply chain support to Ministry of Health, Uganda. And I am happy that we shall be presenting this in this forum. Thank you.
Thank you so much for the opportunity for us to present in this conference. Our presentation will be looking at improving cold chain equipment management in Uganda, a data-centered approach using ODK X application. As an outline for this presentation, look at the next slide. We shall look at the background and briefly give a small overview of why we really took up this initiative in Uganda. My colleague Jacqueline will come in to give us a snapshot of the initial pilot which we did in Uganda in 3 districts. She also gave a small overview on the system, looking at the customized ODK X app for Uganda, the key activities which were conducted, the results, lessons learned, but also she'll briefly take us through the next steps that we have to make sure that we scale it up countrywide in Uganda. As a background, as you note that ministries of health, together with the UNEPI program, one of the key aspects they have is to make sure that they strengthen the immunization program, but also to ensure that vaccines which are given to babies and adults and other age groups are safe for the community and for the population. So ODK X as an application aims at digitizing the cold chain equipment inventories, functionality status, and document maintenance and repair history, and also generates data sets for AP managers to more effectively manage the cold chain equipment inventories. So Gavi as a project, as a program, has invested so much in cold chain in Uganda. Over $8 million have been invested to support cold chain and ensure that all facilities which offer immunization services have very good refrigerators and fridges to make sure that the vaccines are safe. And given that, you find that it's been very, very expensive to conduct inventory updates, which has been costly in a range of between $100,000 to $200,000 just to conduct annual national inventories. Then also one other fact is that the country currently relies on an outdated cold chain equipment inventory records, which is close to 10 years. It means that we do not have very good records of which are the facilities which have these and this kind of refrigerators, cold chain equipment. We lack that information, and it's very expensive to really have updated information to make sure that the managers at different levels, at national, at the district, and also at facility level, to make sure that they take action to ensure that these cold chain equipments are in place. Then also the lack of cold chain equipment visibility at lower levels, inadequacy of real-time data to help resolve the different issues which are surrounding cold chain. So the Ministry of Health embraced the use of the Open Data Kit, which is an integrated supervision tool. It has been used for over between 5 to 10 years by different programs, especially the surveillance division has been using it so much in conducting surveillance-related activities. So riding and leveraging on this capacity and skills of the health workforce in using ODK X, the Ministry of Health, together with the University of Washington, have been testing the ODK X application to make sure that it's customized to embrace the cold chain equipment, such that we can be able to have updated information on cold chain, information for managers, information for managers at the national level, at the district level and lower level facilities to be able to carry out all the cold chain related activities, strengthening it. And with this project, definitely we've been working very closely with the partners, UNEPI being the core user of this application, ODK X, PATH, and also other partners who are in the vaccine management committee like UNICEF, WHO, National Medical Stores, and CHAI. So University of Washington has been supportive to Uganda in customizing this tool and making sure that it's customized, for instance, to be deployed in the 3 districts where it was piloted. And my colleague will be taking us through the initial stage of the pilot. Jackie, back to you. Thank you.
Thank you, John. So I'll be talking about the project we did. It was over a period of 6 months, and I'll be taking you through the activities we conducted, the results, and the lessons we learned, and what plans we have moving forward, as John mentioned. So the initial project, our goal was mainly to evaluate the application, the ODK X application, how viable and its ability in generating and updating our CCE inventories. So our primary pilot objectives were mainly to focusing on the functionality of ODK X application for collecting and updating CCE inventory, and also the acceptability to the users and the data managers. So under our secondary objective, we looked at the ability to document and track the maintenance and repair services and spare parts used during that time frame, and also to document the geographical location of our cold chain equipment. The project took about 6 months. This includes the time the university was supporting us in customizing the tool to capture our interest as a country, and the time of training, as well as the actual implementation and data collection. So it was over a period of 6 months and in 3 districts as stated in the presentation. The key activities that we conducted one was to develop the tool. So there was back and forth consultation with the program, national medical stores, and all the key stakeholders in the vaccine management, as John previously mentioned. Then following that, we conducted a training for the users, and the users were the district cold chain technicians or assistants, and the central level national supervisors, as well as the key stakeholders in the vaccine management space. Then following that training, we did the actual implementation from February to April, where the cold chain technicians were using the ODK X application to review their cold chain, to review and update their cold chain inventory, as well as send reports on the maintenance and repairs they were conducting during this period using the ODK X tool. Then following that implementation period of 2 months, we had an inline survey where we were trying to get back feedback from them and how their experience was. So this time it was during the lockdown and the COVID lockdown, and we managed to remotely collect data from a few of the cold chain technicians and the central level staff at the end of April. But just to mention that a number of cold chain technicians have continued using the ODK X application even beyond the study period. So just a brief overview of the system structure. On this slide, we see that diagram, and this diagram is to just give us an overview of how the structure is. On the left, we see those rectangles, the two boxes. That is the phone, the Android app on the cold chain technician's phone. It gives two-way synchronization of data to the ODK X server. So when a cold chain technician updates their equipment status and they synchronize the data, it's reflected at central level. And if a central level technician updates some inventory information, and it's synchronized back to the phone, so the user is able to see the updates made. And then the tool gives us opportunity to link to our team. As a country, we use DHIS2, but then national medical stores being a key stakeholder in cold chain management space, we also have the opportunity to link to the ERP system that national medical stores uses. And then there's also opportunity to have a dashboard to view our data presentation and the reports, summary reports. On this slide, it's an overview of the cold chain app structure, how it looks like. We have a few screenshots to give us a small understanding of what it looks like. On the left, the tool, you're able to see a geographic hierarchy of the district, of where the cold chain equipment is. Starts with the country, to the district, to the division, up to the lowest level. And it gives us a summary of all the facilities in form of map, if you want to see the map of the facilities where the cold chain equipment is located, or just a list of the facilities by type. It also gives us opportunity to quickly see cold chain equipment needing attention. As long as the cold chain technician updated the status of the equipment to be needing attention, then we'll be able to see it on the tool at whatever level. Then on the right, we have an example of a district vaccine store. So we select and we chose the facilities, the district vaccine store. That is how it is presented on the tool. We are able to see that in this facility, there are 8 cold chain equipment in this vaccine store. And if you scroll, you are able to see a number of functions under this vaccine store. Then some of the functions will be the functionality status of equipment. We are able to see a summary of the functional status of our equipment, availability, voltage regulators, or the temperature monitoring devices like the fridge tag 2. We are able to see whether the equipment was serviced, is it working, not working, debt serviced, as long as the cold chain technician updates the equipment and on the tool. Then for the functional status, we are able to edit and change why it's working. We are able to track that. It also gives us opportunity to activities being conducted on our equipment, and we are able to track maintenance by date, by who did it, and the activities that were conducted. On the left, you can see a presentation of how it is displayed on the tool, who performed the task, the technician's name, the contact. So a central level technician is able to reach out to the cold chain technician in case of further inquiries in regards to that maintenance activity conducted. Then on the right, we are seeing a screenshot of the type of maintenance. A technician is able to choose whether they conducted a repair or it was preventive. And if it was preventive, it goes in depth to get further details of what preventive maintenance was done. and we are able to monitor all that. But then in addition to this tool also gives us opportunity to track the spare parts that have been utilized. And then we are able to document the spare parts utilization, which will inform our procurement procedures and planning. So from this pilot, over 2 months, we collected data on functionality, and this slide gives us a summary of functionality of our equipment over the 2 months period that the data was collected. We see that the data reported was 80% of the 394 health facilities that were available in the districts. We managed to collect data from 80%. And then we also managed to collect data of 80% of all the cold chain equipment within this time frame. We are able to also monitor the temperature excursions, the temperature performance of the equipment. So on the right, that pie chart is a summary of our cold chain temperature performance. The green is mainly the expected temperature range of +2 to +8 degrees. But then we had observation on some freeze alarms, the low alarms, that is in blue, and then also the high alarms reported as seen on that pie chart. Then on the left pie chart, it was a summary of the functionality of our equipment. Over that period, we noted that 60 of our cold chain equipment were not functional. And this data goes up to July because, as I mentioned earlier, there are some technicians who really tool and continued using even beyond the pilot time frame. And mainly these 60 non-functional cold chain equipment were some equipment that were due for decommissioning, but they are still in the system and they hadn't been decommissioned. So they had to be reported on. But we had the details on why it wasn't functional. Yeah. So this slide is a summary of the maintenance and repair activities conducted over the study period. And we can see that we had about 133 preventive maintenance activities conducted, and 3 cold chain equipment were repaired, 3 repairs conducted, with some others reported not specified. So we had about 153 repair and maintenance reports coming through. Then we are able to track the spare parts utilization, and over these 2 months, we see that the most used spare part was a voltage stabilizer. We had 12 equipment had their voltage stabilizers replaced. Then we had 2 thermostat controllers. On the left, that graph is a summary of the maintenance activities conducted. We are able to see that most of the activities reported was mainly cleaning of cabinets, checking seals, defrosting, as you see on the graph. Then on the right, we see that we are able to track the activities that these technicians are doing when they visit a facility. They do more than 1 or 2 or 3 maintenance activities. So for every visit, we are able to see the tasks performed could be 5, could be 6, as summarized. This is because we encourage them not to just go fixing one problem, but to also check all that may require to be addressed, any issue that may require to be addressed. So a technician can go check the seals, clean the solar panels, and defrost, walk through walk the nurse through the maintenance activities she should be doing. So we are able to see that, and that is what is presented on that bar graph. On acceptability, majority of the users and the central supervisors really appreciated the ODK X application, and they thought it significantly improved their inventory data, as well as there was high-level satisfaction of the tool. Then users and central supervisors viewed it as a tool that was easy to use. It was easy for them to maneuver their way through the tool. And they also thought that there was a positive impact on their cold chain equipment inventory analysis. We see some of the statements that we got from their central supervisor technicians. One person said it gives timely data, so it eases the maintenance of the cold chain equipment. While another person was saying the ODK X application is very easy to use and to understand its features. The features cover all the relevant information concerning cold chain equipment. That was one of the cold chain technicians at the district level who said that. We had a few challenges observed during the study frame, and one main challenge reported was the cellular network while syncing the data. Some places are remote and then there's poor connectivity. Therefore, there would be delays when synchronizing the data. But other than that, there were a few minor issues like delay in picking geographical coordinates. For example, if a technician forgot to take the coordinates from outside the building and they were trying to take it from inside the building where the refrigerator was, there would be, of course, such challenges observed. We had one technician who reported a freezing on the phone and he had to restart the phone again. Then we had some facilities were closed at the time the technician visited to check on their equipment, so they were not able to report at that time. But other than that, we had no critical errors with the tool. We also had a few lessons that we learned, and one of them is that ODK X efficiently organizes the CCE data for effective data-driven asset and resource management. There was high-level acceptability of the app. There was clear and tangible improvements in their workflow compared to the current system where they were using papers. Before the ODK X tool, they used the Excel-based files printed out, written, and then they have to come back and type it and send the report to national level. This was making their work much easier. Then we also have opportunity to adjust the application to be able to download fridge tag to data. And at the moment, we are also working on the dashboard and the analysis. Some of the next steps that we have in plan is that as a country, through the targeted country assistance, we've been awarded funding to scale the use of ODK 135 districts in Uganda and to also use it for our national inventory update. We have some capacity building and sustainability activities in plan where we hope to have a prior to start transition plan in place with all key stakeholders involved and with their input. Then we also hope to have a country management team where they will be in charge of managing the ODK X application. So the University of Washington is going to work together with the country ODK X managers team to build their capacity in managing the ODK X application. Then in addition to the trainings that we plan, we plan to have a standard operating procedure in place for the use of the app. So thank you very much for listening. And this is the end of our presentation.